The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Welcome to Health for a Lifetime. I'm your host, Don McIntosh. And today we've kind of rolled up our sleeves. We're going to look at some very practical things. And the title of today's program, Dr. McNeilis, is The Pharmacy in Your Kitchen. Now, you've written a book called God's Healing Way. And I understand that it's in quite a few countries now, 12, is that right? So Spanish and now in Cambodia as well, in the Khmer language and in Romanian and what other languages?
Spanish and several African dialects, Vietnamese, Laotian.
Wow. So it really does not matter where you live today. And as we know, this is an international program. There's lots of people watching in many different parts of the world. If you have the certain different things that you see on the set today, you probably can do what Dr. McNeilis has to say, but probably more than that, there's a spiritual component. I notice you've called it not man's healing way, but God's healing way. Why did you call the book this?
God has a way of healing that is akin to his way of salvation. And we learn in Titus chapter 2, verse 11, that God's grace that brings salvation has appeared to all men. There are no boundary barriers to God's salvation. But we learn also in the third book of John, verse 2, we learn that God, above all things, wishes that we prosper and be in health, even as our soul prospers. In order for God to be fair and just, his saving way and his healing way must be available to all people, not just to people who have wonderful opportunities and of medical care, which we enjoy in some parts of the world and not in others. It must be inexpensive. It must be available without a lot of monetary outlay. It must be, however, invaluable, extremely helpful. It must be easy to understand so that no matter what educational level or from educational school one come from in the world, it is easy to understand. And yet, like many of Christ's simple teachings, profound. It must be simple to practice, available in your house or in your kitchen. It must, at the same time, be highly effective for sin and sickness.
Interesting. You know, I studied the Greek words in the New Testament once, being a pastor and sort of a nurse before that. The word for salvation, as I understand, is sozo, which also means heal. It's the same word. So I really like that fact that the salvation has occurred to or appeared to everyone. Yes. And same here. Now, in this book, you have it's kind of divided in sections. I really like how it's divided, and it kind of deals with different aspects of the health laws than simple home remedies. And we want to talk today a little bit about some of those simple home remedies. And which ones have we fixed up in the kitchen today for us?
We have the contrast bath.
Now, you want me to do something special here? Do I need to get prepared for this? Should I take off my shoes? Or?
Let's have you take off at least one shoe and one sock.
Okay.
We'll say that you have an infection on one of your feet there. You may have done like some of our Amish friends, stepped on a nail out there in the barnyard.
Right there, it looks like there's a little problem there.
And you're getting a little bit infected and red there.
Okay.
And if you had to go into the hospital or emergency room, they would put you on antibiotics very quickly.
And they charge me a lot of money, too.
Oh, that's the problem with the Amish people. They don't have insurance, and so money is a problem for those in our area.
So do I need a tetanus shot?
Well, they do not do that.
Okay.
So that means that, of course, I must get busy
Very
and
rapidly.
treat it
Okay.
in a way that will be helpful. Well, you know, the contrast bath simply means that the water is in a contrast temperature. At one extreme, it will be hot, and the other, it will be cold.
Okay. So
And
what do we start with?
We always start with the hot water.
Okay.
And so that's a good rule of thumb to remember. We start with the hot, and the hot is the longest amount of time. It's around 3 minutes of hot, and then about 1/2 to 1 minute of cold.
Okay, so how hot is hot? You want to put my foot in there?
You know, this is another reason I have rolled up my sleeves.
Okay.
Because what I tell people, if you don't have a bath thermometer, we'll pretend this is the one for the hot water, and this will be the first one,
Okay.
that I want to know how hot it is.
Okay.
If I use my hand, it may not be the same sensitivity as your foot. And so I do what a lot of mothers will do with babies, test the water with your elbow.
Oh, that's a little more sensitive, isn't it?
And you can, if you can leave your elbow in the water and not pull back, it's probably going to handle your foot.
Well, so there's some real techniques involved here in really what you do. Now, let's say you're a diabetic or you can't sense things in your foot or your extremity very well. It's really important then to put that elbow in.
That is correct. And this is one good reason to always start at a bit of a more comfortable temperature, and recognizing that if you have circulatory problems, you will not want to go as hot as you can stand. You may want to simply go at an elbow temperature.
So it's not best for a physician to treat themselves. You need to have someone else maybe to help you out, especially if you have that situation. Should I put my foot in there now?
Let's just check it here. Well, seems like I could have just a little more warm water. So have a tea kettle with some boiling water available that you can just pour in
A little bit more?
little bit more,
Okay.
and then retest.
All right.
There, it's just about right.
All right, I'm going to go ahead and put it in there.
And with a small child, you may just want to assist them to put their foot in and ask them, how does that feel? Is that pretty warm?
This feels different than it's ever felt before. So how long then do we keep it in here in the hot, did you say?
About 3 minutes.
Okay, about 3 minutes, and you don't, you just kind of click it off there. And then what?
After 3 minutes, you will want to transfer your foot to cool water.
Cool water.
Now, if you are a diabetic again, or someone with circulatory problems or numbness,
Yeah.
you may want to just go with cool water, not ice cold water.
Okay.
But if you are young and vigorous and have just simply an infection,
Like us.
we hope, yes, then you can have ice in your water,
Okay.
and that will be
This
plenty
will really
cool.
make you...
Yes, right.
Right.
And with small children, you may want to play a game and pretend the ice cubes are fish or something like that. And you may only go to the 1/2 minute instead of 1 whole minute.
With the
And
kids, I'm
so
sure.
it is adapted to the vigor of the person that you are treating and the degree of severity of the problem you're treating.
Okay,
the more
now-
hot or the more cold will give you the healing effect.
Now, we're treating a nail. I've stepped on a nail. Is that right? Do
That's
I remember what I did? And so what exactly is this doing with that nail? How is it helping? How is this helping?
The hot brings the blood to the surface of the skin,
Okay.
and the cold closes the blood flow to the surface of the skin and drives it inward. So basically, we are increasing the circulation by increasing the movement or the flow of blood in that area.
So it's like your car gets stuck in the ditch and you go back and forth and back and forth. And
Correct.
you finally get it out.
Correct. And the reason that that is done is for very good physiologic reasons. When you move the blood, you are getting in your red cells that bring oxygen and carry away waste materials such as carbon dioxide, products of cell metabolism. You move the plasma, the river in which the red cells travel, which brings in metabolic nutrients to the cells and again takes some of the waste products out. It also brings in your white blood cells, who are the soldiers of our body. Whenever there's an infection, they are there ready to fight whatever germ or ailment is there. And so we bring in the troops, we take out waste, we bring in nutrients and oxygen.
So how often do we do this? Let's say it's just, you know, your typical person stepping on a nail, and how often should we do this, let's say, over a week's period? Do you do it every day? How often do you do it?
That's a good question, because often it depends on the severity of the problem, and if you can catch things right away, you don't have to do things quite as often. But if things have, if you've had a delay in getting treatment, then you may have to be more serious about it. And so what I recommend is anywhere from 5 to 7 changes. And one change is 3 minutes of hot and 1/2 to 1 minute of cold. That's one change.
5 to 7 changes.
Right.
A
I
day?
call it the Naaman treatment.
Naaman, oh, like you're dipping
Like
7
Naaman
times.
dipped into the Jordan River 7 times.
That's a
We
good
learn in the Bible that was to be the sign of his faith for the cure of his leprosy.
It's a good story, too, especially when you're like on time 4 and you don't want to go back down anymore, right?
Right.
Keeps you going. And then do you do that just one day, or do you do it several days in a row?
What I may do, this treatment may be done anywhere from once a day to 4 times a day. Again, depending on the severity of the treatment. And it can be done until the leg or the infection or the ailment is completely disappeared. So I tell people, do it as long as you need to until your condition is back to normal.
Any cautions about this? I mean, you've done this around the world. I'm sure that in America or in a Western type country, we get our water out of the tap. How do you pick water, say, if you're in the middle of the jungle?
We have to pick what we have, and we may not have ice. And I have been in villages where I have not been able to get ice, but there is a well. Well water is not ice cold, but well water is considerably cooler than the tropical air outside. So as much of a contrast as we can get from the hot to the cold will still give you a good result.
So would you pick running water versus water that's been in a...
It won't matter.
Doesn't
Can
matter.
pick it anywhere. But there is one thing that I always recommend to people that is very important. We may not have all of the resources, but we do have one resource, and that's our heavenly resource that is constant with us. And I do always remind people to begin with prayer. And what do I ask for? What should we ask for when we begin with prayer? We ask for God to bless the treatment. We ask for His blessing. We ask for the great physician to be present with us. He knows the ailment. He knows the cause, often when even an earthly physician doesn't. But He also knows the cure. And so we ask Him to be present, to be by our side. At the end of a treatment, I also remind people to pray. And this is the faith part. Thank the Lord that He blessed you with this treatment. Don't wait until you see the result. That is not faith.
Step out in faith, the evidence of
Thank
things
Him
not seen.
for doing that. And faith is the currency that opens the treasury of heaven.
We're talking to Dr. Mary Ann McNeilus. What a wonderful book, and what practical, simple, but powerful and profound things can help us no matter where we live. When we come back, we're going to be looking at more simple remedies that you can do in your own kitchen with your own pharmacy, and looking at more of God's healing way. We hope you join us when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who are able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Diehl and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We're talking with Dr. Marianne McNeilis, and we're talking about God's Healing Way and the pharmacy in your kitchen. And we're going to look at some practical things with, what do we call this, charred wood?
Charcoal.
Charcoal. And then we're going to hear some stories about how God has really used simple means to heal people. What about charcoal? What do we need to learn about it?
Very simply, charcoal is charred wood, or wood that has been burned in the absence of air for a prolonged period of time, and then ground into a powder. And charcoal is the treatment of choice by the American Academy of Pediatrics for poisoning in children. But it has many other additional uses that make it a necessary and important part of your kitchen pharmacy.
So what about this bug bite I have here on my wrist? Is that going to help with that?
I find that a charcoal put on the skin as a poultice is a wonderful complement to the hot and cold contrast bath that we just talked about for an infection. And I am going to make a charcoal poultice first by making a little charcoal paste. And that is by adding a little bit of water to our charcoal powder until it's about the consistency of a thick paste or like peanut butter, something like that.
Probably don't want to do this in your blender.
You might not want to, because certainly charcoal, as you can almost see from the picture here, can poof. That is, it's such a fine powder that any vigorous stirring will cause you to have charcoal in many other places than where you desired it to be.
So you can get this probably as liquid charcoal, as I recall, but you can make your own too.
Yes, and this is the way that charcoal will keep indefinitely on your kitchen shelf. Just keep it in a closed container, and it will keep for a very prolonged period of time. You don't want to leave it open, because charcoal has a wonderful property of absorbing poisons such as toxins, gases, even bacteria and viruses.
So anything that's next to it'll absorb, so you want to keep it closed up.
It will absorb.
Okay.
So you like to keep it closed, but it's an inert substance, and so it will keep at a very indefinite period of time. It's a very nice thing to keep around. Just find a source for getting it, and keep a container or two around your home, and also for sharing with others. It has many wonderful uses, as explained in God's Healing Way in the chapter on charcoal. It can be used for infections. It can be used for bug bites.
So then you have a little piece of paper, whatever you have there.
Well, one very easy way to make a poultice is either with a loosely woven cloth, or if you are where there are paper towels, you can use a paper towel. And a simple poultice can be either made with a paper towel, loosely woven cloth, and a piece of plastic, which I have down here. And I'm going to put that on the table first, and then I'm going to decide what size I want my charcoal poultice. I want it to well cover
right there.
An area on either side of an infected area, because the body will have inflammation in areas where it is around the area that is not showing. Inflammation or infection usually means there's redness, swelling,
Good
pain.
for a spider bite, good for a snake bite, good for any kind of situation?
Yes, good for scorpion if you're in an area, as we have been in some parts of the world where scorpions are, and some parts of the United States where they are. Any noxious substance or critter can be helped, and there are directions on how to use it for these things. But we're going to say that you have a infected bug bite here with some pain and swelling.
All right.
And
so once I put this poultice on, how long do I keep it on?
you can keep it on for several hours or overnight, and you may replace it. It can be used often in conjunction, as I said, with hot and cold water treatment, such as the contrast bath. And It can be left on until you do your next treatment or overnight.
Let's see.
Well, I've spread this on here. It's like the
Paste.
jelly of a sandwich.
All right.
And we'll say that these pieces of paper are the
Bread?
bread.
Oh, good.
And we spread it within about an inch or so of the outer
All right.
rim there so we don't spill out.
And then,
And let's see here. Now you can see we have our little sandwich here.
are you going to put that on my wrist?
And we're going to put it right over the center of this swollen, painful...
Feels better already.
Right arm. It does. Often it can be almost
All right.
miraculous.
Then you
And
put your
then I
plastic
put a piece of plastic on top. And the purpose of this is to keep the charcoal from getting out onto things which it can stain, but also to keep it from drying out. And then I may want to hold it in place with a elastic wrap or just any type of a cloth or binding material.
Okay.
And so then I can just simply
Hold it that
wrap
way.
this around and pin it in place, pin it securely so that this poultice does not move. And then you can leave it on for several hours or overnight. Change it periodically as the condition warrants.
Now, you showed me a picture a little earlier of you doing this type of treatment. Where was it that you did that?
In the country of Romania,
Can we look at that picture? I think that we
I
have
had
that.
an interesting experience. One summer we were going around to different churches, groups, and teaching
there it
natural
is.
remedies. The gentleman in this picture, whose hand is seen here, had about a month before been working and had gotten something he knew into his hand. He didn't know if it was a sliver or just what the nature of the fibrous material was, but the doctor assured him there was no way to go in and retrieve it. It was, and he suffered for about 4 weeks with some tenderness and swelling, and the physician felt eventually it would fester and come out. Well, my Romanian friends that were with me decided to do a natural remedy treatment that evening. Before we were going to have our natural remedy seminar the following day. And that evening, he did a hot and cold contrast bath, just as we did
A little bit earlier.
earlier.
So he put hot for what was it?
3
3
minutes,
Cold
cold
for
for-
1.5.
1/2 to 1 minute.
Oh, well, okay. It's all in
For
the book.
about 7 changes. And then he put on a charcoal poultice, and the gentleman went to bed. The next morning, when he got up, he noticed that there was a little bit of a protrusion on the skin surface there. And my Romanian helper just kind of pressed ever so slightly, and out popped a large sliver that was at least an inch long.
Is that right? So that
Which you
charcoal
see
had
in the
drawn it out?
picture. And the charcoal, and with the hot and cold contrast bath, worked very well to finish what had been festering in there for some time. Well, needless to say, my Romanian friend was more than happy to share with others that wonderful experience. However, I would also like to share one final story that comes from the work with the Amish people in my area. One Friday evening, just after we moved into our new home health retreat in southeastern Minnesota, I was paid a visit with a horse and buggy from our close Amish neighbors. It was the mother with about 4 of her 10 children came over. And I thought, how nice. They were coming just to welcome us. And so I showed them around our new facility, and as I got to the treatment room, the mother suddenly pulled up the sleeve of her little 6-year-old daughter. And to my horror, I realized the true cause of her visit. The story was that this little girl had gotten an insignificant nick in her finger or on her hand 3 or 4 days before, but by now she had pain and swelling from her entire hand really up to her elbow. And she had what we commonly call blood poisoning, or septicemia, or an infection where the bacteria had gone not just from the local area, but were starting to spread through
See
her
some
body.
red lines up her arm?
Exactly, and very painful. She had not slept for several days. But all this time she had not made any noise or any crying or anything, but it did hurt. Well, I saw immediately that we needed to work on the kitchen table. And so my kitchen table was initiated with 2 basins, one with hot and one with cold water.
Contrast bath.
We did the contrast bath. Now, if any of you know when something is swollen and painful, it does not always feel the best to put it in hot water. But the mother admonished her little girl, don't whimper, you do the treatment. 3 minutes of hot, 1/2 minute of cold, 7 changes. And then, of course, I would not let them go home until I had applied a charcoal poultice to the entire hand up past the elbow and encased her whole little arm and hand in a charcoal poultice.
How old was she?
She was about 6. And so then they went home with directions to continue that treatment and plenty of charcoal to make a poultice and to continue with that. The next morning, I was able to stop by the home and discover she had slept for the first time quite peacefully that night. And it was only a matter of 3 or 4 days, and her infection was pretty well completely gone without the need to go in and get antibiotics or a physician visit, which certainly would have had to happen if her mother had not been made aware of some very effective, simple home remedies, all with the power of prayer, of course.
So these simple remedies that we've looked at, really, the contrast bath today, and then also charcoal, anybody can do those. Really, just to summarize it, see if I'm correct, that contrast bath takes the water in, or takes the object in and out, kind of dislodges it, and the charcoal kind of finishes the job with all the different toxins and poisons that are around. Isn't that right?
Basically what it does is that the contrast bath moves the body circulation, which brings in its own natural things, methods of healing, the white blood cells, the nutrients that the body needs to fight the infection, and the substances are drawn out through the adsorptive power of the charcoal.
We're talking about God's Healing Way with Dr. Mary Ann McNeilus. And really, probably the most powerful thing we've talked about today is not the charcoal. It's not the contrast bath. It's probably a prayer. Would you agree with that?
I agree.
And so starting each treatment, no matter what treatment it is, with prayer, and then stepping out in faith, I believe that you said, at the end of that treatment. If you've been interested in today's program and would like more information about this book, God's Healing Way, please contact 3ABN, and we can get you information how to get in touch with Dr. Mary Ann McNeilus. I believe that Dr. McNeilus does seminars and different things also, teaching different groups, and has a real ministry with many different people. We hope today's program has helped you, and that as a result of it, you can use the pharmacy in your kitchen to avoid problems or prevent problems or reverse them if you have them, and that you can, as a result, have health that lasts for a lifetime.